women experience painful or heavy periods. For women living with endometriosis, the cramping and pelvic pain can be debilitating. But medication and surgery can help. The Fox Medical Team's Beth Gallen explains just how common this is.
Endometriosis is very common. It affects hundreds of thousands of American women, and it can cause everything from really painful, heavy periods to infertility. But there are some treatment options out there. About 10% of women in their reproductive years have endometriosis, a condition in which the type of tissue that lines the uterus grows outside of it, triggering chronic pelvic pain.
The youngest patients that I've operated on have been 11, the oldest in the mid-70s. So it really can affect all women of all ages.
Dr. Kenny Sinervo, a gynecologic surgeon at Northside Hospital in Atlanta, says there is no diagnostic test for endometriosis, but the most common symptom is long-term pelvic pain, especially right before and during a woman's period. Women may also have heavy periods, fatigue, diarrhea or constipation during their periods, and bleeding or spotting between periods. The first treatment is usually medication, and if that doesn't work, surgery, typically laparoscopic surgery.
Well, in my case, I use a CO2 laser to cut the endometriosis out. What I'm doing is I'm cutting out the whole root of the disease. And so you really, you're not going to have those little sprouts coming back as you would when you're having an ablative surgery performed.
And endometriosis is linked to another problem, infertility. The American College of Obstetricians and Gynecologists estimates nearly 40% of women with infertility also have endometriosis.
Patients who have more mild disease have about a 60% chance of conceiving compared to the 85% that you would see in the general population. Patients who have very severe disease or stage 4 endometriosis may only have a 1 to 3% chance of getting pregnant on their own.
But Dr. Sinervo says surgery can boost a woman's odds of getting pregnant.
In patients who have mild disease, it goes up to about 80 to 85%, which is almost the same as women who don't have endo. And even in patients who have the worst cases of endometriosis, between 50 and 60% of them can conceive with surgery and possibly in vitro fertilization. IVF may even increase that higher.
And Dr. Sinervo says it's important to remember that women can and do get pregnant, even with endometriosis-related infertility. So if you are planning to start a family or you're newly diagnosed, talk to your doctor about your options. For your Fox Medical Team, I'm Beth Galvin.
Okay, thank you, Beth, for bringing us that.